Giddy up, MB2 Undergrounders. Get ready to clip, clop, or gallop into another episode. I'm Sarah Kiefer, nay.
And I'm JT. Hey, Sarah.
I don't know much about horses. I had to Google what sound they make, and it said clip, clop.
Clip, clop, yeah, they do. You'll know that soon enough when your kiddo's here. I'm sure you'll know all the farm animal noises.
Clydesdale.
Okay. Killer start to today's podcast. We have an amazing guest.
He deserves so much better than
He
that.
really does. Although I think, from my perspective, while we always have amazing guests, I think this one kind of tops them all. A man who needs no introduction.
But please introduce him.
I will. I'm going to introduce him as the Michael Jordan of Dentistry.
The Godfather.
Dr. Gordon J. Christensen. Welcome, Dr. Christensen.
My pleasure indeed.
Thanks for being here.
It's great to be with you.
What did you think about the horse intro? You like horses?
What did I think about what?
My horse intro. Did you
Your
get
horse intro. I have horses.
What kind of horses?
Well,
Clydesdales?
I have had over the years. I've had Polish Arabs. I've had Appaloosas. I've had quarter horses. I now have Pasofino and a Peruvian Paso.
I have no idea why I asked. I don't know what any of that means.
Horses? I've always been interested.
How does one start
they scare
acquiring
me.
horses?
Yeah, horses scare me. Like, how did you get into
Horsing.
having
The
horses?
horsing.
Yeah.
Well, I'm a mechanical type. I collect old cars and new cars. I have the fastest one is a Hellcat.
Oh, sick.
The slowest one is a 50-year-old Land Cruiser that we have put together.
Oh, that's awesome.
Totally.
That's super
But how
cool.
to get into horses? My wife is a horse type.
Oh, nice.
She's an English rider. I'm a hick rider. I go up in the mountains, leap over trees, and do that kind of thing.
Yep.
And
Okay.
she's sitting there jiggling along English. Everybody likes something different.
My kind of girl.
Oh, that's so cool. So where do you keep your horses? Do you have like a farm or a ranch or?
We have a
Stable.
small ranch. We have a 5-acre ranch,
Okay.
and the horses live about football field from my home.
Oh, that's
So when I walk out and whistle, they whinny. They know I'm coming, and I go down there, feed them, go to work.
Have you ever seen one of them birth?
Bert?
Birth. Like, have you seen like a baby horse be born?
Yes.
Gosh, that's crazy.
That's a major thing.
Yeah,
it's a
that's what I
long
figured.
ways up there.
Oh, that's okay.
Oh man.
Terrifying.
I have lived in Texas my entire life. I have grown up around plenty of people that have farms or ranches and have had animals. I went to an agricultural mechanical college.
Oh, you did?
I went to Texas A&M. Yep, Gig'em. But I myself am not an agricultural. I don't have a green thumb. I don't know how to. But I've seen things on ranches, and I don't know that I'm cut out for it.
I'm not either for a lot of the work, but I go home now. Saturday morning, I'll be home. What's my first duty? Shoveling horse manure.
Okay.
As I get when I get home. But I have a little tractor, a little Kubota, and I'm in hog heaven.
That's
I go
awesome.
out there and do that
Horse
little
heaven.
job, and then go on to more professional things.
So nowadays, if somebody was going out to do that, sit on the Kubota and cruise around, they're going to put a podcast or headphones on or anything. Do you
Raw
do
dog
that?
it?
Do you?
I want total silence because I'm around thousands of people all the time. In a year, I probably see 30,000
Oh my
dentists
gosh.
face to face.
That's awesome.
That's badass. I don't think I've ever, even when I'm walking around Target, I have my headphones in. I don't want it silent ever.
Yeah.
Then
No,
I
I sometimes I like just sitting. I used to work at a golf course, and we would, go pick the range, and you'd be sitting in a cart as you're driving through.
Yeah.
Wouldn't listen to anything except the gas motor of the cart, and you're getting pelted, and it was so peaceful because you're just out there by yourself with your
Yeah,
thoughts.
because
just
men
driving.
don't have that many thoughts going on at a single time compared to women.
Yeah.
Like, it's a little scary and quiet for us.
Maybe.
I like noise too. I have
You just get plenty of it.
a bunch of motorcycles. One of them I can wake up the whole neighborhood with.
What kind of motorcycle is it?
That's a Harley.
Okay.
but I've got some quiet ones too.
I was going to say, what's your favorite motorcycle you've ever owned?
It depends. If I get up and I'm tired, I'm going to get on a three-wheeler, a Can-Am.
Okay.
We just went around Lake Superior 2 weeks ago, 1,300 miles,
Sick.
and I take groups of dentists on these. I speak half a day. They get a good tax write-off. And we've done that forever.
That's
we've
cool.
done Yosemite, Yellowstone, Switzerland, New
Oh, wow.
Zealand.
That's amazing.
And they love it.
I should have done a motorcycle intro. I know more about motorcycles than horses.
Wow.
Really?
Yeah, I messed up. Yeah, my
Next
dad
time.
has always been really into motorcycles. Actually,
What kind?
a couple of years ago, he witnessed a friend get in a pretty bad wreck. So he's been a little off the train.
Mm-hmm.
But when I was little, I came home one day and he had a little Pee-wee dirt bike for me. And so I used to ride. I didn't ride for very long, but I at least know a little bit about that.
Shout out Jeff. So Jeff is Sarah's dad, and he is a faithful listener. So we try to shout him out every episode.
Just to really see if he's paying attention.
Yeah.
So we talked a little bit about your hobbies, but tell us a little bit about your upbringing. I saw in the notes that you came from a very blue-collar family.
Oh, I did. My father was a sugar refiner, sugar beets. So I grew up as an agricultural type. I went to Utah State Agricultural College as my first of many schools. And
Utah State Aggies.
and I learned
Is that what an Aggie is? Is like an agricultural reference? Like Aggie,
Yep.
Oh,
Sick.
yeah.
We just blew
The
Sarah's
Aggies.
mind.
Yeah, we just bonded.
Yep, we did.
My father had a third grade education. My mother had a high school education, but they were both highly motivated toward getting their two boys. There were only two in the family, two kids, and so as I grew up in that family, education was always like this. Where are you going to college? It wasn't, are you going to college? Mm-hmm. It was where.
Yep.
And where are you going to get your doctorate?
Oh.
Not if you are.
Right.
And it wasn't dogmatic. It wasn't coercive. It was just factual. It was declarative. And sure as heck, I did all those things because I was too dumb to know otherwise. And so did my brother. He was a Stanford MBA after the Second World War. Became president of one of the largest insurance companies in the world.
Amazing.
So that the two of us came from that relatively uneducated family. I learned a lot of things about that. I learned that education is mandatory, but it's a union card. You really learn, as Einstein said, by doing.
Mm-hmm.
Yeah.
That's one of my most recognizable and appropriate quotes. The only true learning is by experience.
Oh, yeah.
That's Albert Einstein. And I see that in dentists. I see it in veterinaries I talk to, physicians. How many of these things have you done? Oh, I've done a half dozen. How many have you done? 200? Where am I going? This guy.
Yep.
Right.
Yeah.
So how did you enter the world of dentistry?
That's an
And
interesting
why?
question.
Thank you.
I happen to be LDS, the lay name Mormon. And my bishop, that's like a priest or a rabbi, was a dentist.
Okay.
Very altruistic man. He would give you the shirt right off his back. He worked, as most dentists do, 4 days a week. He had a life. He had a lot of community service. He had kids that I played with, and I thought, that sounds pretty cool.
I love the amount of stories about people getting into dentistry for like the lifestyle.
Oh, yeah.
I think that's super cool. I never considered anything like that when I was growing up and trying to figure out what I was going to be when I was an adult.
I don't know that I knew growing up that like there was so much, I'll say flexibility. Now, it takes hard work to get there, but it was funny because when I got to MB2, I started realizing, I was like, wait, a lot of these guys don't work on Fridays. I was like, why didn't I pick
Most don't
that?
work on
I was
Fridays.
like, why didn't I do that? Like,
Well, I bumbled into it, and I knew nothing about it.
okay.
Literally nothing about it.
Just that you really like your bishop. He's a cool guy,
yeah,
he's super
yeah. I
wanna be
nice,
like
great
him when I
family,
grow
good
up.
flexibility. Like that seems cool. I'm gonna go check that out.
Yeah.
Huh.
And
And here you are.
My hands have been very, very workable, right from almost birth. I was carving things and making model airplanes and doing all kinds of things. So jumping into dentistry was no real problem at all.
So when did you, I think I was reading, you graduated dental school in SoCal in 1960, is that right?
Graduated in 1960.
Yeah.
I went there in 1956.
That's what I said. I was like, he started dental school when he was 20.
That's awesome.
You want to know what I was doing when no, you don't want to know what I was doing when I was 20, but it wasn't going to dental school. That's insane.
So you've been in dentistry for 60 plus years at this point.
66 years.
66 years. And
that doesn't count school.
And we're gonna
Yeah, let's round
cover more of what you're doing, not just the because you've gone from being a dentist, and you still are. Do you still practice today?
Oh yeah.
Yeah. Okay.
A few days a month. I have 50 full-time employees, so there's no real time. And last year I did 200 courses, all over the years.
How?
How?
Like there's 360 days in a year. You did 200 courses?
No, I've done them all over.
That's amazing.
I was in Norway 3 weeks ago. I was in England 2 weeks ago.
Where's your favorite place you've traveled outside of the U.S.?
Outside of the U.S., I'd give you 3 or 4.
Hit me.
I have Scandinavian heritage, so I love Sweden, Denmark.
cool.
My 2 generations back, the family was from Denmark.
Okay.
But they were itinerant types. So I've got Danish, Swedish, Irish, English. My wife is Italian, Hungarian,
cool.
so we're all mongrels.
Love it. Wait, so you only gave me 2. Sweden, Denmark, where are other places?
Sweden, Denmark, England,
Okay.
Ireland,
Ireland. Okay.
Wales. I didn't give you all of them.
Yeah, man.
I
need
don't
to
know what
build
they
a
did
bucket
because
list.
you couldn't. There wasn't travel much then in the 1800s. My dad was born in 1891. My mother was born in 1899. Wow. I barely made it. Seriously, I don't know what happened. It was an accident, I'm sure.
Oh man! So you've graduated dental school in 1960.
60.
You're a prosthodontist.
I'm a surgical prosthodontist. Yeah.
Okay. What from a clinical dentistry perspective? Let's start there. You mentioned it was. So I told you I asked some of our partners if they had questions that they would ask, and I was like, "Hey, give me some questions that you'd like to know," because I know you said you listen to some of the podcasts. Sarah and I, we're not clinical at all. We are not dentists.
That's why you're good.
And it's
good question askers.
we have a lot of fun. But I thought this question from one of our partners here in Texas was really interesting, and it goes with the Einstein quote that you said. Right, the learning is in actually doing.
Yes.
He said that he probably heard his first lecture from you 35 years ago, and he said there was biological, margin or something was a real hot topic in dental school, and you stood up in front of a class and said, "Hey, I've practiced this. I don't even focus on that. I don't worry about it because." The body has shown a resiliency that the margin will come back. And so his question, he said, you should ask Dr. Christensen, what's something in your experience clinically that despite the teaching, despite, what research, what that says, like your experience would say, hey, this is something that you've actually seen prove itself out. Is there anything out there
besides biological margins?
As I go back to COVID, this may not be the exact kind of question he wants answered.
That's great.
We have to wear a mask. You can't touch things. You can't breathe on one another. You can't. And my wife's a PhD microbiologist.
Shout out.
So I have to not say these things to her. She can't hear this. I have practiced now, 66 years. I seldom get a cold. I've never had a serious disease. Mm-hmm. Yet Center for Disease Control said, dentists, you shouldn't be going to dentists because they're passing disease constantly.
Yeah, the spit and stuff.
And they got over that. Of course, that guy was from a third world country. He was Ethiopian, so what did he know about first world? Mm-hmm. And that's the head of World Health Organization. the condemned dentist. So when I hear that something doesn't work, the first thing I do is try it. I'm very serious. So I thought, well, I didn't wear gloves for the first 20 years.
Really?
Well, nobody did.
Yeah.
I could tell what patient I had seen. Blue impression material, Mrs. Jones. And of course I had probably every organism on the earth in my body somewhere.
Yeah, so then you were resilient to it all.
And my wife, of course, being a PhD microbiologist, was so meticulous. It was absolutely absurd. She would put Hibiclins, a disinfectant, on her apples before she'd eat them.
Oh, man.
And the first time I bit into one, I thought, geez, that's a bitter apple. Well, it was, it had a disinfectant on it. So then I got into some research. Well, that's one of my activities, to see if dentists lived longer or shorter than the normal population. They live longer. Do hygienists live longer or shorter than the general population? They live longer.
That's
Do
fascinating.
dentists have more diseases than the normal population? No. Do physicians have more diseases than the general population? No.
That's
And
so
why? Because we're working that far from somebody, breathing all the goobers out of their nose and mouth. They don't have a mask on. I've got a mask on.
Right.
That's why I got a little rash on my nose right now. But I hate masks. I really do.
Don't we all?
There is some research now saying it doesn't do a dang bit of good anyway. I'm not sure of that. But the bottom line is, I learned very, very early that all this infection control stuff is nice to know.
Yeah. Do you feel like you've always had a propensity to research, or did that come later in your career after you started
No,
dentistry?
it came early.
Did it?
I was up in the mountains gathering up deer skeletons and heads of animals and so forth.
You're such a fascinating
even
person.
in before I was a teenager. Yeah, I'd go up with a gun, shoot something, dissect it.
Now
No,
we'd be
that's
worried about kids
not
doing
people,
that.
No.
So Sarah's pregnant. She's got she's having a little boy, and like hearing you say that, I've got 3 boys, and it's like they're fascinated with dirt. They want to know about guns. Like the curiosity of my kids is one of those that, like, it's fun for me because I get to kind of relive childhood.
Oh my gosh, I would think my kid is a serial killer.
But I would love nothing more than just to, hey, we're going to go out into the woods and we're going to go shoot a squirrel with a BB gun or a 22 and we're going to figure it out.
Poor guy.
I had a nerd friend in high school. He's the only guy I could study with. He ended up going to Harvard, and I did the things I've done, but he was the only guy that had the same kind of interest I did.
Huh.
Dead animals.
Yeah, dead animals,
It's not necessarily dead animals. It's how things work. That's the fascination.
Exactly.
Yeah.
Exactly. Yeah.
So how long after you started practicing dentistry, I mean, we've got your resume here and all of the things that you've done over the years. Did you start going, okay, I want to expand on this. I want to do something a little bit deeper, whether that's...
Every day.
Okay.
I go in
You
and
went
I
in.
say, what don't I know today? And I'm pretty old. I should be in a grave. The normal male dies at 78. I'm long past that.
Because you're a dentist.
Like 20 years past that. I really do. I go in and I say, okay, what don't I know today? Where can I find that out? Who's smart enough to tell me? That's an egotistical statement. Who knows more than I do on something?
Yeah.
And then I go after that person.
That's amazing. Like the drive or the curiosity. Frankly, I think it's the curiosity. Would you say that, like, you were mentioning this on the, like, when we got in, you said, hey, I stay busy. I keep doing this. I love doing what I do, and it keeps me going. Do you, I mean, genuinely, like, the curiosity that you have every day you wake up and you're like, I'm going to go and I'm going to do this. You just mentioned the average, life expectancy of a male is 78 years old, and you're older than 78. Like,
20,
do you think
20 years older.
Do you think that's been? I mean, that's what you like. You wake up and you're like, hey, every day is a new day for me, and I'm excited to learn. And you think that? Do you think that's kind of what's gotten you to where you are?
I am a PhD psychologist.
Okay.
Educational psychologist, and yes, you have to keep doing things.
Just keeping your mind young.
Or your mind withers.
Okay.
By the way, I'm not 20 years older than 78.
Yeah. Like, let's preface.
No.
I did read an interesting study on how learning new things and creating new synapses in your brain can help reverse the signs of Alzheimer's and dementia. They did a test on nuns.
Yeah.
That makes sense.
Yeah.
So it certainly does.
Yeah. So you've led in multiple different areas, and I'm going to read off a list because there's too many. So religion, military, education, and research. Okay, that was 4. But what do you feel like you have the most passion behind in one of those areas?
Education.
Education. Because you helped start dental schools. That's dope. People can't usually say that.
Like, did you just come up and be like, you know what, Kentucky doesn't have a dental school, Colorado doesn't have a dental school, we should start these? Or how did that come about?
I popped out of dental school, and I had my diploma in one hand and my Army commission in the other hand. Otherwise, they would have drafted me anyways, Vietnam. And then I had 2 years piddling around with that nonsense that the politicians screwed up on. I got out, and I thought, I really like all of dentistry. I don't want endo. I don't want, oral surgery. I want all of it. And the only thing I could go into then was prosthodontics or general dentistry, or in a limited way, pediatric. That's the only thing that's broad. The rest are some little narrow thing. So I did one graduate program, the first graduate program I did there at University of Washington, because I was stationed at Seattle during the Vietnam thing, trying to fix kids up before they went over to get shot.
Oh.
And
public service.
And the bottom line, after I finished that course, I was recruited to go to Kentucky to initiate that school. I was one of the core faculty members there. And I learned a lot.
Oh, I bet.
Yeah, I learned a lot because Eastern, you may know this because you're working with a lot of 800 offices or so. Eastern dentistry is far different than Western dentistry. And Midwest is kind of a combination of the two. I'm going to be very broad, but the Eastern dentistry tends to be more biologic.
Okay.
Well, you got Harvard, Connecticut, you've got a lot of the more biologic schools there. Western medicine tends to be more mechanical and handsy. When I went to Kentucky, that was about the time of the Goldfinger movie, if you remember that movie. And they called me Dr. Goldfinger because I was the mechanic, see.
Okay.
And but I did salvage that first class.
Okay.
Because they had already started some. And
okay, so here's a question for you. Another question from one of our doctors that I think is really interesting. And I actually read this. You had done an interview with somebody and scratched the surface on education today in dental school. And basically, I am going to use my own words. These were not your words. But the deficit that many new graduates come out with relative to some of our partners, or I'll say the mid-career or seasoned dentists. And so one of our partners out of Kentucky asked this question, which I thought was really good.
Shout out, Dr. Binkley.
Gosh, and I'm going to read it. Dental school today, how would you redesign dental school education today as it is so you could increase the relevant clinical experience that new grads are getting?
that question has an answer in it already. There's no relevance in half the schools today, period. Of the 70-plus schools that are out there right now, I don't mind saying it. Somebody's going to whine when I say it.
Oh, nobody listens. It's
only
fine.
about half of the schools would I send somebody to.
Really?
Yeah. I'm not going to name the name of the schools, but now I'm in Boston next week, and I'm speaking a day in Boston. And my Tony, the one that some of you probably worked with, the lady that sets me up, has set up a group of students that night. The last time I was there, I had 1,000. I had Harvard and BU and Tufts. And they were senior students. We get Shine, Patterson, Benco, one of the outfits, to buy them a pizza and a soda pop. And I talked for an hour and a half.
The dream.
And it was very easy to tell who went to Harvard, who went to Tufts, who went to BU, and I'm not going to differentiate them. We'll let the audience differentiate those. How would I design it now? When we started the Scottsdale Center, which I was dean of that big continuing education center, I had 24 departments. And I said, okay, whoever, endo, what did you get in school you never used? And what didn't you get in school that you had to do the first day?
Yeah.
I went through all of those 24, and I ended up with a curriculum. What didn't you get that you needed the first day? And then, if you didn't get that, you got to have some basic science. What basic science do you need? Well, crown and bridge. I need to know ceramics. I need to know metals. I need to know occlusion. And we built the basic science curriculum around what was void in the current curriculum.
It's crazy to me that that's not how curriculum in general works. Like this trial and error feedback and
I would agree, because what you've said is so simple.
Yeah.
It's like, what is the actual practical application of, I'll use my background. Like I have a finance background, and sure, you take courses and you learn various things, and at that point, and forget them. But it's like, practically, what did I do in college that has stuck with me from that point in time to now? I loved my experience. I learned a lot, but but I look back and I'm like, I don't remember what I learned in that class, or if anything that I learned actually applies to what I do today or my day in and day out. So it's fascinating.
Well, and it kind of goes back to his quote, like the best education is experience. So then everything we learn is in the real world. But what if we could learn through experience while we're still in a learning phase? I
think we're going there right now. The higher education is in gross trouble.
Yeah.
Now that you can go on Chat GPT or Gemini or any one of them, click, and I got the answer. Do I need to read a whole freaking book?
Yeah.
That's what I was going to ask, is do you feel like there was like a pivotal change in dental school curriculum between, like JT said, the mid-career seasoned dentists and our new grads? And like, what was that changed so significantly?
Well, I'm going to give you my thoughts on it.
Yes, please.
That's why we have you.
We have humanistic schools and we have Hitler Youth groups.
Oh.
Okay.
What does that mean?
And what does that mean? That means you do what I say or you're out.
Got it.
In fact, when I started school a century ago, practically, the dean came on and he said, look left and look right. By next year this time, one of you will be gone.
Yep.
They won.
Yeah.
That's a Hitler Youth group.
Mm-hmm.
That's a coercive organization, like a prison, like a school,
like DFW
like a
Airport.
church. They're about a half a dozen coercive things. And you do whatever they say or you're done.
Yeah.
And you don't run education that way. I'm going to go back to 1700 with you to the Socratic method. When I teach, I'll bet I ask 100 questions in the first hour. Because their brain, if I just sit there and mumble, they're gone. If I ask, okay, what failed last week in your practice? Now I got their eyes open. I've got them thinking.
Yeah.
That's Socrates.
Engaging, not talking at people. Yeah.
The student answers the question to the best of their ability, and then they're asking you a question to answer the rest of it they couldn't answer. Not the way. I got one of my grandsons in a medical school program right now. He'll have as high as 8 classes a day, and it's all memory. I don't even have to think. He won't remember a tenth of that in a year.
Yep.
That's what I remember about college, was memorizing facts so that I could pass my tests.
That's right. And how long did you learn it? I remember it probably a day. till you had a big wild date and you forgot the whole thing.
Literally, yeah. When I drank to celebrate the fact that the test was over and it left.
Yeah.
Okay, that's a good answer. I think now's a good time. We should switch over to some of these questions from our listeners.
Well, hang on though. I want to.
Not yet.
Yeah, not quite yet.
Okay.
So when you do kind of going along that, pulling that thread, and you've mentioned the courses that you put on, your continuing education courses. You're going to be here tomorrow talking with a big group of docs. Is that how you ultimately organize your CEs too, where they are very interactive and you're asking questions and having folks interact and respond continually, or is there a lecture Q&A? Like, how do you typically run that?
How do we make a course up?
Yeah.
Let's take something relatively current. Cascold restorations.
Sarah and I were just talking about that earlier today.
I said, man, if I hear those words one more time, about $1.
Cascold restorations, on the average, done even at a moderate level of adequacy, will go 40 years. A composite filling, international data, a large one, will go 6 years.
Okay.
6 years. It's white. It's white. Yeah. Yeah. I'll tell you the story of me. My dad being a sugar refiner, when I went to dental school, I didn't even know how to brush my teeth.
Huh.
Oh, that was fine. You rub this thing around. I had no idea what was happening.
Mm-hmm.
So I had a lot of big black amalgams in the back of my mouth. And I thought, I'm a freshman student now. I don't know anything. Can't even spell words. And I thought, you look pretty smart. You're a senior. Would you do my crowns? He turned out to be the freaking village idiot. But he did Cascold restorations for me, cemented them with ancient cement developed in 1880, zinc phosphate cement. They are still there.
Yeah.
They're still, most of them. I've lost a couple.
So you're rocking stuff from the 1800s in your mouth right now.
Technology.
Yeah.
I mean, that's pretty cool.
That's really cool.
Well,
oldest
we've
thing in this
gone
room.
backwards on it. If you really got me going.
Okay, no. That's actually one of the questions. That's one of the questions I had, because it's something you said.
Yeah.
Do you think, or I'll just let you like take this and run with it. What is your opinion on technology in dentistry? Has it improved or has it
Disimproved?
Yeah.
Deproved?
You're on one of my
unimproved.
favorite topics.
Improved. Hit us.
I'd love it. I'd love to hear it.
I'm limiting my practice, which is small. I had 10,000 patients before my church dragged me away. I gave them all to my prosthodontist son. And when I came back, I've done mainly dentists.
Okay.
It eliminates the diagnostic stuff. What do you want? And it's over, you know.
Yeah.
Anyway, we have tested now 47 dental technologies. I could name even all of them that are supposed to be better than analog. You know what I'm going to say?
Well,
Say
you've
it.
already
Only
answered it.
12 of them were better than analog.
Oh,
Of
dang.
the 47.
Wow.
I can make an impression in vinyl polysiloxane or polyether for $7.
Mm-hmm.
Or I can buy a scanner for $18,000 to $65,000 and pay $250 per impression for the first 2 or 3 years. And I could do it for $7. Well, if it was better, that'd be something. But it's so inaccurate compared to the vinyl and polyether that it's absolutely absurd to talk about it.
What about the time? Is there any time saving with it?
Maybe a minute
Damn.
with the scanner. I'm not negative about scanners. Scanners will make it.
Yeah,
They're
sure.
on the way. I take technologies in a continuum. Early adapters. Early adapters are in printers right now,
Okay.
3D printers.
Yep.
Yes.
If If I get a group of 300, well, I'll ask the group tomorrow, who's printing? I'll probably have a half dozen in the group.
Yeah, I think, I mean, from my experience, and I talk to prospective MB2 partners every day, yeah, there's probably maybe one in 5 or one in 10. They're like, oh yeah, I have a 3D printer. Oh, we bought 3D printers. Yeah. So yeah, I'd agree with you on
that's
that.
an early adapter.
Yep. Mm-hmm.
But they're now advertising, oh, you can do your crowns. Do your crowns. Do my crowns. A typical composite resin is 70% filled with inorganic filler. The printers, some of them are not even 10%.
Wow.
We've got some at 50%. ADA has limited it to 51%.
Okay.
And they're advertising them as a crown. Mm-hmm. They're charging a crown.
So do you think technology in dentistry puts the integrity of the profession at risk to some extent?
Vehemently, without any kind of reservation, yes.
Yeah, that's interesting.
The honesty is gone. Yeah. Gone. We evaluate, on an average, somewhere between 500 and 700 new products per year. That's 30,000 samples sent out to 450 evaluators around the earth in 100 countries. Long sentence. But, and what do we see? Once it's had its basic science in Utah, basic science says something. That's almost all in vitro, not in the mouth.
Okay.
It goes out in the field. It worked in vitro, but there's a fleck in this. I squeeze this stuff out, and it's got little black flecks in it, and it won't come out. It's too rigid. So that's in vivo. My wife has done studies now on zirconia for 27 years. Even though monolithic zirconia, the newest form, has only been out about 11 years. But we've got in vivo stuff there that just blows away the in vitro. Oh, this is very strong. Yeah, but it sucks. It broke in the mouth.
Yeah.
So you got in vitro, in vivo.
Yep.
Unless you marry them, you don't have the answer.
Okay.
This question came from one of our listeners that's actually just me. Have you ever considered donating your brain to science at some point? Like, I was just thinking how much, like, I didn't understand anything he just said, but like how much knowledge and how much experience that you have, which is probably why you teach 200 classes a year.
I think about that often, not about me, but I think the smart people I know die, and almost everybody my age is dead already, seriously. And I think the people that I put on that questionnaire you gave me that really have influenced me, they're dead. Where did the knowledge go? It's gone. Yeah. It's gone.
So you would consider donating your brain to science?
I don't know. I'd donate yours.
Nobody wants to see what's going on up there.
No, it's a real challenge. It's in there. We know that physiologically. It's still in there, but it won't come out. Mm-hmm. And the older you get, the less it comes out.
Or the more pregnant you get.
Oh, well, yeah.
That too.
We wouldn't know anything about that. We'll trust you on that.
You could never.
So back to your in vivo, in vitro technology. Are there any technologies like that you've seen in your career where you're like, they did it right, or that actually has improved and advanced dentistry?
Absolutely. Cone beam of all the 47 things we have tested is right on the top of. There's nothing else that will go there.
Okay. Yeah, makes sense.
You got 2D, you got 3D, and then you got slice, and you got everything in there. Cone beam. Mm-hmm. You can't take my cone beam away. You can take 2/3 of the technologies away, and I'll do a cheaper and better job with the analogs. But then we have workflow, which is some kind of fantasy. So, I just did a video on digital dentures.
Okay.
And if it fit into the workflow, which only 8% do on a digital denture, You cannot digitize moving tissue. Let's go out on the beach and digitize a wave.
Yeah.
There's no way. You'll have 1 millisecond.
Yep.
So we just dropped the digital workflow. Because we have to make an analog impression and digitize it. And that's what, well, only 8% are doing true digital workflow. And I don't even want to look at the impressions.
Right.
Because all it's got is the still view of all these contours and ripples and things going on in the mouth.
Interesting.
So that's an example of where, although we've worked with companies that are trying to blow air on the tissue and make it still, you've got to move every single muscle in that mouth to get an adequate impression. So they either have to make a reline when they're done, analog.
Could have started there, is what you're saying.
Or they could just do the normal technique and it's simpler. Oh, yeah. Yeah, you know. So, yes, technology's here. Technology's wonderful. Technology will gradually win, but it ain't there yet. We've got early adapters, first 5 years. Let's go back to printing. We've got the next 5 years to figure out if the early adapters finked out and gave it away, or if they got ecstatic and moved. Look at CEREC. 6 to 10% are still using CEREC. After 40 years, we were the first ones in America to have CEREC. Only 6 to 10%. What happened? Price was too high. Technology was too hard. All the programs kept changing. They'd come in the middle of the night and had different icons on the stupid thing. So they kicked themselves in the butt, and they lost it. I could go to, back when I was in its early years, I could buy CEREC for half the price in Europe, the same device they had here. So many mistakes were made on that. So there's a technology that those who have it, most of them, love it. And a lot of them have got it on eBay and Dentaltown.
Yep.
So that didn't make it. Well, it made it for the few that have got it.
Sure.
Cone beam is now almost 50%. Why is it slow? They got to get it less expensive. Scanners. I want a scanner that's that size, that has the camera at the right angle so I can get into my little puckered up mouth, or on the distal of the second molar. I don't want a big double-sized cigar to stick in there, which is what I've got now. For $18,000 or up to $65,000, I can take this stupid thing in my pocket, which has more information in than my first computer, University of Kentucky. It was the size of a car.
For our listeners, he's showing his
This has
phone.
got many times that much. And they can't put it in this pencil? Yes, they can. But we're so stupid, we keep buying these other things.
Preach.
You can see I have a little passion there. It's all about one big dollar sign. You brought it up. We've lost the honesty.
Well,
We've lost it in medical and dental.
You know what they say, the MB2 Underground podcast, we're all about passion. That's one of the taglines, I think.
He just made that up.
No, I'm not anti-technology. I'm anti-telling me the technology is better than the analog unless it is. 4 out of 5 of the ads that we test are false.
Yeah, that's
Staggering.
I mean, it's so cool that the review, the clinical review, or I guess now it's called the CR Foundation.
Yeah.
You started that back in the 70s,
76.
is that right? 50 years? Almost 50 years?
We're going on 50 years in January.
That's incredible.
Yeah.
Congratulations.
It is such, and I was reading some of the stats of, how many countries it's in now and how many languages it's translated, because you're providing this information to doctors so they can make the right decision for their patients, for their clinical dentistry. And you're like, look, I'm not trying to say it's good, bad, or otherwise. Like, here's what we found. You take this information and do.
Nobody pays us.
Yeah. Do with it what you will. But that's so cool.
And we're the dilemma. Why? Because of AI.
Let's
what
talk
are
about
your
AI.
thoughts on AI in the dental space?
I used to teach statistics.
I love statistics.
Did you?
That was one of my favorite.
class.
That's actually,
Was it?
talk about classes in college. That's one of the things that I remember. I'll say remember the most about. Do not test me on it now, but
Yeah,
Yes,
I'm
that's the
the
first-
same way I used to teach it. But it was an old calculator, like chi-square, it would take me a day. But where are we with AI? Let's relate it to statistics. You've got good and bad on any different project. And you analyze it, and it comes out at a given number, which is mean or average, whatever you want to use. So where are we? If I want to know an inferovelar canal, where to go with it, I know they're going to be from that wide to almost non-perceptible. Do I want an average? No. Right now, from my statistical background, I'm on AI every day. I'm on one or more of the sites. And I look at it on something that I know well and say, horse manure. If I don't know it well, I say I've got to look into that and see what part of it's horse manure.
Mm-hmm.
So I got to have HI and AI today.
Human intelligence. I get
Yeah,
it.
human intelligence. AI is going to make it, but my daughter works with one of the major distributors,
okay.
and she's in their AI section. And they're having a hard time selling it to dentists. We actually ran a survey to see if they trusted HI. Do I have to say anything? No, there's no trust at all. At all. You take a scanner where you've missed part of a tooth, and you've made the impression all around the mouth. And they take the other tooth on the other side and put it on this side. Do you trust that? No.
Yeah.
I got one ear lower than the other. I got one finger longer than the other. We're not bilaterally symmetrical at all.
Yeah.
I won't say I'm out on AI because, like you said, AI will make it.
Yeah.
And it needs more iterations and more iterations,
sub-program, sub-program. I don't know how many programs.
But I saw something the other day where I can't remember what it was. It was like a camera, and they were trying to identify. They had AI identify the humans in this picture, or it was a video, and they had somebody put a cardboard box on and walk across this, the screen, and it identified it as a cardboard box.
Oh.
And they had like the humans like doing different things, and it was like, oh, it identified it as a dog. Oh, it identified it as a Diet Coke. It identified it as a microphone. And these are just people walking across the screen. I was like, oh, okay, we got a little ways to go before we get there.
Yeah.
A long ways.
Well, and
yeah.
especially in something that feels as technical or mechanical as dentistry.
Oh, yeah.
I had a conversation recently, and there was in a group an estimated 150 dental offices that would be interested in an AI pilot, and 8 signed up. And that's what it told me was there's not enough faith in what it is yet.
The word is trust. There's no trust right now.
Yeah. Oh, yeah. That was one of the questions that came in from Dr. Laidlaw.
Yeah.
Shout out.
Shout out, Dr. Laidlaw.
Can I ask the next one?
Yeah, go for it.
Okay, I don't know what I want to ask though. Hold on. What do you feel like has been the most influential change over the last 50 years in dentistry?
In dentistry.
From Dr. Lerg.
I just wrote a paper. I was writing papers all the time, but I wrote a paper for Dentistry Today at their request on the future of dentistry.
Shouldn't it be Dentistry Tomorrow then?
No,
Sorry.
basically what I did, I summarized all the major things that had happened in my career in dentistry,
Okay, hit us.
and that was the start of it.
Okay.
Yeah, it's into the publisher now.
Okay.
I don't know when it'll come, a month or two.
Okay.
And it was
Definitely
pretty
Dentistry
interesting.
Tomorrow.
I don't know how many I had. I had about 20 major things that had happened in my career. I go clear back to belt-driven engines, run with the pedal, where you pumped your foot up and down.
Very Flintstone.
And as I got into the military, the air rotor came on from University of Illinois, and it had one speed. $300,000. And you'd make big holes in teeth. It was stupid. But big class ones. You couldn't control it at all. And then 5 years later, it evolved past early adapters into the first 10 years, and then finally it became good, and then along came electric, replaced it. Anyway, I did all, go ahead.
Do we think AI is in that phase right now?
Yeah, it's not even there.
Yeah.
It's just a bunch of miscellaneous things that they've added together.
Okay, got it. Continue.
Nothing's congealed
And
yet.
given you a meaning.
Congealous, yes.
Well, what was I on yesterday? I can't even remember. I
TikTok.
asked him. No, I asked him. I asked who was it? Gemini, the Google one.
Oh yeah.
I asked. Geez, I can't remember what it was. How many dentures does a typical general dentist make in a year? And I went on several of the AIs, and they all had a different answer.
Oh, that's fun.
Yeah. It's got a ways to go.
Yep.
I'm hopeful that it will help in a lot of the technical things,
Okay.
as robotics will. I've watched GOMI evolve over the last 10 years. When we first did it, I challenged the guy. I'm a surgical prosthetist. I said, if I've got a space on a lateral incisor that is 5.5 millimeters wide, and I want to put a 3.25 millimeter implant in there, let's see you do it. He just laughs. That was 10 years ago. But then I just gave a program in California where the GOMI guy was there and the same guy, and I said, can you do it now? And he didn't remember. And he got close. See, so there's 10 years of evolution. We're getting at the point where maybe if they get it below $125,000, it'll make it.
Yeah. We've got, I know one of our partners, more than one, I'm sure, but one that I know that I worked with that loves it and has talked about how it's helpful. And I mean, they were willing to put out the money to say, hey, this is going to be something that's going to allow us to do more dentistry in the practice.
It might. I'm a very fast dental operator. And when I get some of this so-called speedy stuff where, well, I've done thousands of implants. You give me a, pardon me?
That's a lot of implants.
Yeah, since. Let's say I'm putting 4 implants in down there. Oh, I need a guide. You need a guide? Put one halfway in and parallel the other 3. I'll be done in 15 minutes. I don't need a dang guide for $300 and all the stuff that goes with it.
Yeah.
So, yes, analog's good, but analog's not in the workflow. See?
Okay, so let's go back to the dental school conversation that we were having. Have they, again, I know nothing about dental school, but have they gone away from teaching analog, or at least the
there's
core competency?
Some
like
schools
for sure.
that will not, they cannot make a typical analog impression.
Okay.
They don't even have them in the school. It's all done with scanners.
So they just
They're not
don't
even teaching basics.
Yeah, people don't even. I mean, dentists don't even know how to do that at this point.
And the lab techs don't know
Interesting.
how. They don't know how to forecast and so forth. I'm not saying that's bad.
Yeah.
The scanners just have to get better and smaller and down to $5,000 to $10,000 instead of up to $65,000.
The evolution of education is outpacing the evolution of technology.
Yeah.
Yeah.
Yeah. No, I don't want to sound like in this webinar that, or podcast, whatever you call it, I don't want to sound negative about technology.
No. I don't.
Because some of the technologies have made it.
Yeah.
I collect old cars. I've got numerous old cars. And I look back, when I get in, I've got an old Porsche 911,
Sick.
30 some odd years old, virgin. I get in there, I want the heater on. I don't even have to look. It's right there. Click. I haven't had clickety click, 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 click.
Yeah.
Oh, the freaking thing won't work.
Or getting out a manual.
You know what I'm saying?
Yeah.
Well, Porsche is going to go back to dials. Mercedes is looking heavily at dials. Yeah. This big mother screen there.
I
I
hate
don't know
them.
where we've gone.
I hate them.
And then everybody
I love mine.
copies everybody else. You got to have a little fin on the back of the car for the teenagers that does nothing other than.
Probably just ruins the gas mileage, frankly.
Well, unless you have tailwind.
I guess.
I'm just kidding. Before we wrap
gosh.
up, I'm going to ask one last question, and I'm calling an audible. I'm going to choose it.
Go
When's
for
the
it.
baby coming?
Oh, you can ask. Okay.
Dr. Christensen said, no, I'm asking the questions here.
I'm doing January.
Oh, good.
Yeah, I'm half baked now.
Yeah, okay.
Okay, is it my turn? Okay, one of our doctors asked, what is the secret to a long life besides germs?
Okay. I'm going to get serious for a minute. A belief in God.
Okay.
I seriously believe that. I don't care whether you believe in the God. There's only one God, unless I go to India and then there are 100. But the bottom line.
I think it was Macklemore that said, no matter what God you believe in, we all come from the same one.
That is exactly right. Yeah, exactly right. So anyway, somebody put this thing together. I'm a real outdoors person. I'm up in the mountains at least 2 or 3 times a week.
Yeah, killing
Not
and
for
skinning
long.
animals, yeah.
No. I'll go up, sit in my car. I'm on a motorcycle or horse, and I'm alone with the big man. That's where I get my direction. That's the most important thing. Ask the question again. See if I hit the core of it.
What's the secret
No.
to a long life?
Yeah.
Oh, the secret to a long life.
Yeah.
It relates to a plan for you and a plan for me. Why did you like statistics and not something else? Why are you working here and not somewhere else? I believe there's guidance, whether we want to accept it or not. We just had the meeting of the Ensign Academy, which is the Academy of LDS Dentists. We had, I don't know what we had there, maybe 500. And we had the president of the ADA we had lined up to speak to the group in an evening session. And it's not the normal ADA, puckered up, black suit, guarded type person. He had been a drug addict himself. You may know this guy. And he gave us about an hour, and he got a standing ovation because it was so heartrending. He was guided by the good Lord, but didn't know it. He said, I'd get suicidal, and something told me no. And I'd get suicidal, and something told me no. That's the third level of the Trinity. You know it, the
That's
Holy
powerful.
Ghost. Assuming there is something guiding us, all we got to do is listen.
Yeah.
And that's what's guided my life,
I like that.
literally.
Yeah.
That's awesome. That's awesome.
I ask him, why am I still working? All my friends are dead. I have no friends.
I thought we were friends.
We are now.
You're friends.
Yeah, we are
no,
now.
but the bottom line is, I keep getting the motivation, keep working, shut up.
Yeah.
That's the
And
secret
so
to
you
a
keep
long
going.
life. Keep working, shut up. I think that's-
No, there's another word to get out of the serious mode, and that's eclectic activities.
like horses.
Horses, dogs. I have German Shepherd dogs.
Dope.
They're just like people. I was on that church job for a few years. My barn is about half a football field long. It's heated. I had 2 then, and then I'd have to left home. I was supervising a bunch of missionaries, so you can't come home. So I came home at the end of the thing. I walked in the door, and down on the other end where the 2 dogs flopped down there, their ears went up. And they looked at me and they ran. I thought they were mad at me, but they wouldn't leave me after those years.
Oh, because they didn't know you were coming back.
Yeah,
And then you came back.
I love animals. We have dogs, cats, horses, 14 great-grandchildren.
Oh, my goodness.
Yeah.
It's a lot of great
That
grandchildren.
is a lot of
Oh,
great
we had a rugrat party last weekend. It was a petting farm.
Oh my gosh, that's so fun.
And it was fun. You were slipping in the horse manure here and there, and the goats would come up and butt your in the rear end. But all those rugrats in that party were almost impossible. I can stand 1 hour because most of the greats are 1, 2, and 3 years of age.
Oh, wow.
Wow. Wow.
That keeps you young too, doesn't it?
Yep.
Yeah, it does. But just for an hour.
That's right. That's right.
Small doses.
Have you got other kids?
This will be my first.
You're going to change your life.
Oh, that's what I hear. It's already changing my life. Can't sit in this chair for very long. No. Is there anything before we wrap up? I know you've got a big day ahead of you tomorrow, but is there anything that we didn't discuss that you wanted to touch on?
Yeah, one thing.
Okay.
What would make a young medical or dental, and why do I say medical or dental? Because many of the countries I speak in, you get a dental, you don't get a dental degree, you get a medical degree, and then you go to dental school after medical school, which is the way it should be here, and which I'm pushing for, and so is the new president of the ADA. Let's get back to our roots. You can't eliminate dentistry. It's the biggest specialty of medicine, for crying out loud. So how do you get one of these young people coming out at 200 to 600,000 in debt? I've got a couple of $1 million in debt right now. How do you get them to still have a conscience, to still not over-treat people? Mm-hmm. You're seeing so many things in dentistry over-treated. I don't have to say that to you. I'm seeing patients come in and said, you've only found one cavity? The last guy said I had 10. I'm not exaggerating.
Tale as old as time.
And I see it, breast cancer with women. We got to do the whole operation when they could do a lumpectomy. It's all across medicine, literally.
Conservative, yeah.
Dishonesty. Mm-hmm. Overt dishonesty. I could stand before the Supreme Court and say that. But it's the government's fault to some degree. We can bomb everybody on the earth, but we can't take care of our own education and medical care. Mm-hmm. Something's wrong.
Yeah.
Fundamentally.
How do we get these younger people? American College of Dentists is really trying. I had a group of 50 young people recently who want to go back to honesty, not over-treatment planning. Mm-hmm. Not telling them something that is a half-truth.
Yeah.
That's one of the things I would really like to see happen.
So what would you give as advice to those in dental school now or just having come out of dental school? What advice would you give those?
I would say work as fast as you can to learn what you don't know. I have a whole course on that. It's called Faster, Easier, Higher Quality Dentistry. It talks about life for about half the course and how to organize your life and how to save your money.
I need that.
10% for savings, 10% to some charity, church or school or whatever, and they got 80%. But you've been taxed too. Mm-hmm. So get yourself in that 10, 10, 80. And if you work hard, you're going to be a millionaire by age 40 as a dentist. You will. If you get 3 or 4 cars and a divorce in 5 years and all that, you're not.
Yeah.
You're not.
You got to start over.
Yeah, so there's a plan. I counsel students every week to some degree. I'll have a few every week. And I talk to the universities in the Utah area constantly. Mm-hmm. To pre-dents. Yeah. You can be honest and still run a wonderful practice.
Yep. And
feel honest every night when you go to bed.
We say it around here. You do the right thing and good things will happen.
Yeah. That's the other tagline of our podcast.
Yeah, it is.
There's another, but there's a bottom side of that. What goes around comes around.
That's right. Mm-hmm. That's right.
If you're screwing people,
it's coming.
It's coming.
It's coming.
Yeah.
Well, Dr. Christensen, thank you so much for spending time
with us.
This
appreciate it.
This was a lot of fun. And we covered a lot, Sarah.
I think we did.
Kind of like Dr. Christensen's covered a lot.
Damn straight.
So,
well, it's been a pleasure. I'm very impressed with your people, your facility, the enthusiasm that I've met with the driver.
Yeah, we have a lot of fun. That's no doubt.
You should have some fun.
I love it. Thank you so much.
Yeah, thank you.
It's been my pleasure. Get a good baby. Do you know what it is?
Did you say get a good baby? That's what I'm hoping for. Yeah, it's a little boy. So he's going to be, before we know it, playing in dirt or skinning animals.
Shooting at 22.
Golly.
I have one regret that comes over constantly. He's 2 last week. That was the petting party. And he would go around picking up the horse manure.
Just trying to figure it out.
Lord help me.
Just trying to figure it out.
I didn't see him eat any of it.
All right, we'll see you next time on MB2 Underground.
All right, MB2 Undergrounders, we've reached the conclusion of this episode with Dr. Gordon Christensen. We'll see you guys next time.
Bye.